Hi, my name is Megan Williams.
And I'm Natalie Ramos.
And we are doing Composite 2 restorations for our class with Ms. Linda. All right, so it's going to be quick and easy. It's a 30-minute procedure, but we're throwing it in an 8-minute video, so try to hold on with us. So to begin, we will see our patient and go over the patient's medical history. This is just to make sure that the patient has or has not taken the medication that they necessarily do or do not need. And then afterwards, we will continue on to describe the procedure to them so they can have a better understanding of what exactly they're here for. Then after that, because
we'll
we're
ask
doing
them questions if they have any.
Well, exactly. Yes, we will ask them questions. They will ask us questions. It will just be a whole question exchange. So after that, we will begin to shade match them. This is to make sure that the actual composite material that we are using matches with the rest of their lovely mouth. So we have this great shade guide here. And you look like an A2, sir. So with the A2, we are going to grab all of the A2 flow and composite material to then continue this procedure. That is then going to numb this patient.
Okay, first we're going to start out by using the topical. We're going to dry the area. And then place that right where we'll be working. Then we'll leave that on for about 3 to 5 minutes. And then we are going to begin to place the local. After we place the local, we're just going to rinse that taste out the patient's mouth. And then we're going to make sure that they are completely numb by using this cold spray.
Alright, and they seem completely numb to me. So, to continue on, I'm just going to check the tooth to get a better idea of where all of the cavity is. Alright. Now, I'm going to begin prepping the tooth with my high-speed handpiece, the 256 burr. That is then going to assist me with the HVE sectioning. I am just simply prepping the tooth. I'll continue on then with my low-speed handpiece, my 33 and a half. Alright. To make sure I got all of the cavity, I'm going to then use a spoon excavator. Alright, it's all done and cleared. So now we're just simply going to isolate the tooth. If necessary, you would have the dental dam, but right now we don't have one, so I'll just simply put on the Tofflemire, and that's going to hand me the wood wedges to apply. Thank you. This is just making sure that the area is completely isolated. Alright, with the acorn burnisher, I'm just going to burnish the band there to make sure that everything is all seated well to continue on with this restoration. I'll then etch the tooth at the cavo service center of the tooth, the deepest portion. And then afterwards, we are then going to rinse, suction, and dry this whole area to make sure that this doesn't irritate the patient. It has phosphoric acid in it, and that could really irritate the mouth.
Alright. Next, we're going to place the bonding agent, which comes in a little thing like this. And we're going to use our micro brush to do that. Now will also be placed in the deepest portion of the prep as well. Okay, we're then going to sort of dry this by using 2 puffs of air. And then we're going to cure it for 2 beeps.
We'll then continue with the putting out the flowable composite material into the deepest portion of the tooth. And then that's going to get cured for 3 beeps. I'm going to check to the tooth to make sure that that area has fully been cured and hardened so that we can continue on with our actual composite material. And looks perfectly good to me, so we can continue on.
Then we will take the composite material, and as she's filling up, she's going to do it by 2 millimeters at a time.
This is just to assure that we're filling up and hardening the composite material, sorry, I'm like tongue-tied here, within layers. You have to make sure with composite material, it's not like amalgam, you can't just simply pack it down. You have to do it layer by layer.
And we will cure for 2 beats.
Alright.
We'll then repeat this step about 2 more times until the prep is fully, a little overfilled.
Then I'm going to use my acorn burnisher and just burnish that whole area. Alright. I'll then use my explorer to then check the interproximal areas of the teeth as well. Thank you. Yep. My gloves ripped from my lovely, thank you. I'm just going to change that out real quickly. Hopefully that only took like 5 seconds. Alright. So, after using the explorer and carefully checking the area, then we then cure it one more full time to make sure that everything is completely hardened. Then we are going to take off the isolation pieces. Alright. Top of Meyer band comes off. Alright. Then afterwards, we're going to cure it 2 more times. Then I'm going to begin to check the bite. Alright. Patient's going to bite down for me. Bite doesn't look too perfect yet. I'm going to need my burrs to then get the rest of this. So, I will continue on with my diamond finished burr. Alright. That'll be on my high-speed handpiece. I'll check the bite again, and then I'm probably still not perfect, so I'm going to need to get the interproximal areas. Let me just double check with my explorer really quickly. Yep. Alright, so I'm going to use my mandrel, not Madrid. And make sure I get those interproximal areas. Alright, we should be okay. I'm just going to double check with the floss. You just want to make sure that your patient is completely comfortable every time he bites down on this. Alright. He seems good, so now we're just going to finish up with the polishing. I'm going to use on my low-speed handpiece. That's going to place the material onto it. Before I even press it to start polishing, I need to make sure that this is right on the tooth so polished material doesn't flow everywhere. Alright, make that look nice and pretty for the patient.
Alright, and then after that, we're just going to do one final rinse and suction.
After this, then we can sit the patient right up. And then we will go over post-op instructions with our patient. He's going to continue being numb for the next hour and some change. You want to make sure that this patient isn't eating anything that can potentially hurt him. He doesn't want to accidentally bite his cheeks or his tongue. That's all. That's pretty much it. If he has any other concerns, I mean, he can call back to the dental office and let us know, and then we'll see him again. But that is the whole procedure then, guys. That's composite restorations. Woo! We're done! All right.